Well, if you have problem veins, you're probably annoyed because you have to dress to cover them up. But there could be some underlying medical issues that you need to be concerned about. Today, Terry Morrison, owner of the Morrison Vein Institute, and registered nurse Barb Deisterman, they are here to share some more information about the veins. And I'm so glad you're here because I've had a misconception, I think, this whole time. Welcome you both to Sonoran Living.
Thank you.
I should say welcome back.
Thank you.
All right, we'll start with you, Barb. Why do you think people should be concerned about their veins besides just them looking bad, right?
Right. If we can identify an underlying venous insufficiency early, we can kind of ward off the long-term effects of blood clots, leg discoloration, and skin changes.
Okay. Yeah, I mean, besides it looking bad, it's obvious that there are some things that could really be serious, right?
Yes.
What procedures do you guys do? I mean, how has it changed since way back when?
Well, the most important thing I tell patients is that no longer do we have to have vein stripping for any reason, and no painful saline injections, because that's what a lot of people think. So it used to be that people would go to the hospital with general anesthetic and be treated in a hospital, but now everything can be done in the office. So we have what they call endovenous laser or radio frequency energy heat. It just means heat mechanisms that are done under local anesthetic in the office that shut down the inner problems with the legs, and then we treat the cosmetic or the surface veins that people see on the outside.
Because you see some of these veins and they just look
scary.
I mean, yeah, I mean, you know, we had a gentleman, I'm not going to give his name, but in the green room, and those veins, they looked painful, and there's obviously some health issues that can go along with that. Terry, let's go ahead and talk about these, because I look at these and I see these really pretty nylons.
I know. Well, most people think that compression stockings are grandma hose, and one of our teachers even said that the children called them her Barbie legs. So we wanted to be able to tell people now that there's compression stockings for men and women, and there's even athletic socks that come in green and red and pink and black and white, so that you can wear them for athletics. You can wear them while you're waiting to get your veins treated, but more importantly, we suggest that people wear them for long-term sitting at a desk or on an airplane or car rides. You know how we have all the winter visitors?
Right.
And the bad thing about the fellow that was in the green room is that a lot of men don't have the early warning signs of pain that women do because of our hormones, so they wait till veins rupture or get a blood clot.
Now, Barbara, is this something that women should do, I mean, just because, or do they do it after, you know, they've had surgery? How do you know when to wear these?
We do it both before and after.
Okay.
You can use these support hose to kind of help alleviate symptoms of pain, swelling, cramping, restless leg, and even itching. And then we also use them after the procedures for a 3-week period of time, just to give the best results.
Okay, good to know. You know, you hear a lot of people that get pregnant and then they seem to get more veins. You know, and you could see them during their pregnancy and after their pregnancy. Yes. If someone is seeing this, I mean, should they wait until they're done totally having kids before they take care of this, or can they do it right now?
They should do something about it right now.
Okay.
Usually what happens is it was an old myth that you had to wait till you had all your children and let all those veins get huge. But a lot of times that even is dangerous for delivery. If women get them in the groin area, it could you know, make their delivery very uncomfortable.
Okay.
So if you start out wearing some type of support hose during the pregnancy, and then after the pregnancy we wait about 3 months, because sometimes those varicose veins subside, and then if they still are symptomatic, we can do an ultrasound, which is no dyes or anything, and look inside, treat the veins, and then when they get pregnant the next time, we would just do a touch-up after the next pregnancy.
All right, well, it sounds like getting rid of the veins, the varicose veins, it has come a long way. And you guys are going to be here throughout the show, and we're going to get some questions.
Okay.
We want to make sure that you know how you can reach out to Morrison Vein Institute. They have offices in Scottsdale and Tempe. The number is 480-860-6455, or you can give them a call at 1-866 GRT legs, sort of spells out great legs. And you can go to morrisonvein.com or morrisonvein.org. Again, we are going to have them on the show throughout today. And today we are actually going to take some emails on this topic. So if you have a question about veins, head to sonoranliving.com, and then all you have to do is click on the house calls button, and we're going to be here answering them live on the air. So just stick around, get on that.